To all of you folks logging on, just letting you know that we'll probably wait another minute or two until we get a critical mass, and then we'll jump right into our program. All right, it's about 2 minutes after the hour, so why don't we jump into our program? Looks like we got a pretty good group to start, and I'm sure we'll have some other folks filtering in. I'll start by just saying welcome and thanks for joining us this afternoon for this conversation. My name is Jonathan Butler, and I'm the president and CEO of One Berkshire. So throughout the past month, our organization has seen a major uptick from our members and other businesses and stakeholders in the region seeking better information about the resurgence of COVID-19, the Delta variant, and ultimately seeking some guidance on what this all means for our own organizations, our activities, and the things we do for our families and our loved ones. In response to this, we're very pleased this afternoon to collaborate with the leadership team at Berkshire Health Systems to provide some important updates, recommendations, and an opportunity for all of you to ask questions that we can get some answers and clarity on. Our format this afternoon will run very similarly to our One Berkshire virtual town halls. The Berkshire Health Systems team will run through an important presentation, and then we'll open up this webinar to some Q&A, and we'll definitely wrap this up by 2 o'clock to keep everybody's workday kind of on point. At this time, I'd like everyone to know this live discussion is being recorded and also simulcast through Pittsfield Community Television. It will also be made widely available through other One Berkshire channels over the next few weeks, as well as through some of Berkshire Health Systems. Listeners can submit questions through the Q&A button on your screen, and we'll do our best to get those answered in this discussion. Live transcript, closed captioning is also available with this webinar for viewers that need that service. So with that, I'm going to get out of your way. We have a great team here from Berkshire Health Systems, and I'm going to start by first thanking David Phelps, the president and CEO from Berkshire Health Systems, who reached out to us a few weeks ago, hoping to get a conversation like this together. So we're very pleased to be doing it. And I'll turn it over to Dave to introduce his team and get this presentation going.
Thank you, Jonathan. And let me thank everyone for joining us today, and to Jonathan, the One Berkshire team, and to PCTV for making this update possible. Over the past 17 months, we've had several sessions like today's to have the opportunity to share important information and to seek the community's assistance in responding to the challenges presented by COVID-19. Today, there are trends that require our renewed attention and our diligence. The effectiveness of our response to the challenges we talk of today will determine the kind of fall and winter we have here in the Berkshires. But before I introduce my colleagues, I want to express our gratitude to the healthcare workers, the public health nurses, our first responders, and all who support them. They have been at this for 17 months and their work continues. And it is a challenge for them every day. They deserve our gratitude. The good news that we have for you today, though, is so much has changed since this pandemic began. We have tools that just weren't available to us 17 months ago. We have testing capabilities, much more sophisticated and readily available than they were before. We have therapeutics, and we have the miracle of science has given us vaccines that are just remarkable. When you look back over 17 months, it's just phenomenal where we are today and why we're confident that we can move forward in a positive way if we all work together in this community. I will tell you before I introduce my colleagues, to think just how far we've come, pick an area, testing. At our first inpatient case, which was back in March a year ago, it took the process for getting a test for our inpatient required us to call DPH, who then called CDC. And after that process, which took almost a week, I'm told, we then were able to get a test and get a response back for a total of 10, 11 days. Now we've gotten used to the capabilities that in every part of our county, you can go get a test. And when you find out that you may have to go 12 to 24 hours for the results, you're disappointed that we weren't able to give you the rapid test that gives you a result in 15 minutes. And when you hear more from Darlene and from Dr. Lederer about just how effective vaccines are, I think we'll take time to appreciate just how far we've come, and the science is just miraculous. My colleagues will share with you more information about the capabilities and opportunities we have, and let me introduce them to you quickly. Darlene Rodowicz is our Executive Vice President, and many of you have known her as one who's worked with me for the whole time I've been here for almost 30 years in these senior level roles. She's a resident, she's a former CFO. When this first happened, pandemic, she was assigned to be the chief executive responsible for our corporate response to COVID. She's an expert on all details of COVID, done a remarkable job, and we're grateful to her. And then there's Dr. Lederer, who we must have had tremendous foresight, because when we hired him 2 years ago to be our chief medical officer and recruited him from part of a national search, it turned out that he's fellowship trained and board certified in adult infectious disease. And it's come in quite handy for us. And he has become not just our internal expert, but a tremendous resource for our community as we determine how to move forward and how to best respond to the challenges of COVID-19. So I think we'll start with Darlene, and she will walk you through and give you a good sense of what is the COVID presence in our community today.
Thanks, Dave, and welcome everybody. Thank you for giving us some of your important time today to talk about COVID and where we are as a county. Jen, if you could change the next slide. I wanted to take a few moments just to walk through where we are today as a health system in the county and what we're seeing as it relates to the COVID virus. Today we have 11 patients in-house who are COVID positive and receiving care. This number is a fairly constant number that we have been seeing for about the last month or so. In that 11, only 2 are vaccinated. The remaining 9 are unvaccinated individuals. And so that really does represent that about 80% of our population that is requiring hospital care is in the unvaccinated population. We hear that at the national level as well. We find that the vaccinated, the 2 that are here and that have been here in the past tend to be very elderly and have other comorbid conditions that are working against them. The average age of the vaccinated individuals is about 86 years old. Compare that to the 9 that are unvaccinated. Their age ranges from as young as 23 to as old as 79 years old. The average age is 52 years old. And so, this is indeed one that is a virus that is incredibly tough on the elderly that have other medical conditions going on. But this Delta variant has made us all very susceptible to the virus and what it can do to us. We are fortunate with the vaccines and the success you'll see in a couple of slides where we are with vaccines in the county. But because of the vaccines, our inpatient numbers are not what they once were. In January, before actually December 31st on New Year's Eve, we saw the biggest surge going. We had in January about 60 patients a day that were COVID positive. And so the vaccines have definitely helped us somewhat with managing the inpatient volume and our ability to take care of all the other illnesses that have always been in our community. When we look at the testing, the bottom half there in the circle, you'll see on our 7-day average a 5.3% positivity rate in our testing. We're testing about 500 people a day right now. This 5.3% positivity rate means about 28 people a day are testing positive in our community. And obviously there's a lot of spread going around there. The highest rate we've seen in our positivity testing was 8.1% on December 31st. That was our high water mark. And it was, if you could remember on that day, it was Halloween parties to Thanksgiving celebrations to the Christmas and Hanukkah season. A lot of social get-togethers that created that surge, and none of us were vaccinated at the time. But this 5.3% we've not seen since Thanksgiving. We were at 5.1% on the week after Thanksgiving. And so just to give you a sense of what kind of spread is going on in the community, even with the vaccine, we're seeing a relatively high rate of positivity that we'd like to address. Part of it is because the community is open. We are able to go out and partake in social activities that we were more cautious about in the past. But with this kind of rate, we really want to focus on the things that we still know work: masking, hand washing, social distancing where we can. Important for this slide, though, is making sure that everybody remembers that testing is a really important tool in managing the spread of the virus in our community. We have 3 testing locations that are open that we encourage people to use if they have any symptoms whatsoever. I would encourage you to just remember that for your employees, that they should stay home if they have any symptoms and go get themselves tested before they resume activities of either going to work or doing any kind of social activities. So Jen, just change again. The next couple of slides are published by the Commonwealth every Thursday evening. You can see these numbers. I've just pulled a couple of slides here for you. This one represents what percentage of the community that is 12 and older and eligible for a vaccine has received at least 1 dose of the vaccine. In Berkshire County, we're at 80%. When you look at the Commonwealth, there are counties in the eastern part of the state, as well as the Cape and Islands, that are doing better than Berkshire County, but we are doing better than the majority of central and western Mass. So that is some good news for us, and like to keep that trend going and moving upward. The next slide that we have also is just the same graph, but this is a graphic of what percentage of our population is fully vaccinated, which means 2 doses of Pfizer or Moderna, with 2 weeks after receiving that second dose, or 1 dose of the J&J vaccine to get fully vaccinated, and we're at 70%. So there's activity still going on with folks getting vaccinated. We're vaccinating about 40 to 50 people a day at our vaccine locations. We'd love to be doing more than that. We have seen a slight uptick with the FDA approval and hope to continue to see more and more people getting vaccinated as children go back to school and with the FDA approval. And then one more slide, Jen. This slide here also just breaks out the cohorts. I think Dave mentioned this already, but when we look at it in age groups, the first set of circles represents where we are as a population in the state for vaccinations within these age cohorts. And if we look at the circled area, in Massachusetts, the vaccination rate for the 20 to 29-year-olds is 70%. In the US, it's only 58%. And unfortunately, in Berkshire County, our vaccination rate is 60% for that age cohort. It is the one age cohort in our county where we are not following closely the mass population trends. And we've been trying to think all summer long of where to find these 20 to 29-year-olds and what we need to do to engage them. I think it's important for you to know, as we think about your workforce, that is an area, I think, of vulnerability for us. They by and large will likely do well if they were to get the virus, although there is certainly no guarantee, as evidenced by the people that are receiving care today. in our health system. But that age group is also very efficient at spreading the virus, just like any other age group. So really important. And there may very well be parents in that age group too that may not be given the best protection to their children as well as we look at that. So again, information for you to understand by age cohort. When we get to folks, 60 years and above, really good vaccination rates is again the younger population, the 20 to 50-year-olds that we'd like to see more attention to. The 12 to 15-year-olds, given the number of months that the vaccine's been available, is actually pretty good as kids go back to school. So we're encouraged by that. I think that's what I have for the data to round out the data, and I'm going to hand it over to Dr. Lederer now just to talk about the vaccine itself.
Thank you, Darlene. So yes, I wanted to take a moment now and just hit some of the quick topics on COVID-19 vaccine and hopefully address many of the issues that you have. I did see one question that asked about boosters, and we will touch on booster shots as well. So on the next slide, one of the first issues that hit the public mindset is, this is so new. How can we trust it? Well, it's really not so new. The DNA and RNA technologies have been around for at least 30 years. I remember as a young infectious disease fellow in 1989, starting in a Group A strep research lab working on a strep throat vaccine, that we went to Cold Springs Harbor, New York, to listen to kind of the newest and best and kind of like best science. That's how you learned about best science back then, is you had to go to a professional meeting and listen to the gurus talk. And they presented a lot of information on DNA vaccines and RNA vaccines, and even plant virus vaccines, because we were interested in making a strep throat vaccine that could be given to third world countries in a banana. And we were using plant viruses to carry little bits of DNA into a banana cell so that they could produce the vaccine we wanted. And so this has been going on for a very long time. And at least over the last 30 years, when you look at the published literature on the development of these type of vaccines, very safe, very effective, and very efficient. It's a quick and easy way to make a vaccine with focus on just exactly what it is you want. So gone are the days of mincing up bacteria and injecting them, in a killed state to try and get a broad vaccine response. Now we can be very targeted once we learn what the most efficient molecules within the virus or the bacteria are. So mRNA vaccines are here with us. I've heard just recently that there are 2 in development for HIV. And we've been on the HIV vaccination strategy since 1985 and have been nowhere with that. So maybe there's some hope that being more targeted using this vaccine, technology will help us with things like HIV. Next slide. And people question whether or not this was tested enough. Well, in retrospect, right now, I can tell you it's been tested 200 million times. That's how many people or doses of vaccine have been given in the US. Very safe, very effective. But the original clinical trials for Moderna, J&J, and Pfizer used anywhere between 23,000 and roughly 40,000 in their clinical trial studies. Since those initial clinical trials, we've had subgroups that have been studied. So we're looking at kids age 5 to 12 as a separate study group. We're looking at pregnant women as a separate study group. We're looking at immunocompromised individuals like kidney transplant patients and others as a separate subgroup. So the data collection goes on and on and on. And we have a robust collection of data that shows the strength, the durability, the efficiency, the efficacy of all of the vaccines. And now we're starting to see data that shows how a booster or third dose goes to support even higher levels of immunity. Next slide. So what about pregnancy? What about fertility? This is kind of a good news slide and no news slide. So in terms of fertility, I don't have a study that says, if I give 1,000 women trying to get pregnant a vaccine, that they'll get pregnant as the same rate as 1,000 women trying to get pregnant who don't take the vaccine. That study has not been done. We don't have that information. What we do know about fertility is that the COVID-19 virus doesn't just attack lung cells and your nose and throat, and we know it attacks brain cells, and we know it attacks gastrointestinal tract cells, but it also attacks the reproductive organs of men and women. And we know that harm occurs because of that attack. So there are people who have active COVID virus infection that as a consequence may have fertility problems to follow because of the immune attack that took place, or because of the virus attack that took place by the COVID virus infection on all the tissues of our body. That's the problem with COVID, is that it doesn't just attack the nose and throat and lungs, it attacks all of our tissues. And so we have already shown that fertility complications are likely in some folks who've had severe COVID infection because of the COVID's infection's attack on the male and the female reproductive tract. Now, on the other side of that, we do have information that really speaks to pregnancy. We've had some head-to-head studies of women with vaccine versus pregnant women without vaccine. And we know that the outcomes of the pregnant woman who is vaccinated are better than the unvaccinated. The unvaccinated woman likely will suffer more severe disease, more likely to be admitted to the hospital, more likely to experience fetal loss or stillbirth, more likely to have severe complications of COVID than a pregnant woman with, who did receive the vaccine. So unvaccinated pregnant women do horribly. And that's not unlike influenza, chickenpox, you name it. Many viruses, because of the relative immune deficiency state that is pregnancy, are able to attain a much greater foothold and cause more harm than in non-pregnant women. So we know that pregnancy, fetal loss, and stillbirth is much higher in the unvaccinated woman who's pregnant than in the vaccinated. Next slide. Our friends at Bay State have made a nice infographic that helps women understand, the very specific points of vaccination versus unvaccination. If you look in the lower gray box on the left-hand side, you see that it says COVID is very dangerous. It's more dangerous in pregnancy. Pregnant patients are 5 times more likely to end up in the intensive care unit than non-pregnant. So you can see the risk is there clearly for pregnant women. Preterm birth, more common. Stillbirths, more common. Fetal loss, more common. These are the things that you have to know when you're taking a chance with delaying your vaccine until after the pregnancy. Your pregnancy is at risk, and you could harm yourself. Certainly, you could harm your unborn child. Next slide. And as I pointed out, we have on our employee portal many of these articles that describe the injury that occurs from COVID-19 infection to women and men of reproductive age. And it's one of those that it doesn't definitively state that fertility is unaffected by vaccine, but it does definitively state that if you get a COVID infection, you are likely to have potential impact on your reproductive organs due to damage from the COVID infection. Next slide. All 3 vaccines are effective in protecting against serious illness, hospitalization, and death. That's just a fact. All 3 vaccines are highly effective, even unto the Delta virus strain. Now, while it is true that in the early days, back in June and July, or May and June, we relaxed a lot of our Massachusetts guidelines. We kind of turned off some of our social distancing. We turned up our participation in events. We have more capacity in our restaurants and shopping areas. People got back together, and we thought we were doing it because we were well protected. And unfortunately, the Delta virus outbreak in Provincetown taught us differently. It taught us that if you closely cohort folks together, put them in a dense population situation, that this virus is capable of being transmitted and causing illness. But what it didn't do in Provincetown was cause death and significant hospitalization. I think in all of the Provincetown outbreak, I think I saw there was one mortality associated. And that's far different than what native infection would have done back in January of last year. So all three vaccines are very effective. And on the next slide, you can see our cases to date in Massachusetts. As of August 21st, we've given 4.49 million doses of vaccine. That's how many people have been fully vaccinated. 4.49 million people have been vaccinated here in Massachusetts. And out of that 4,449,000, as of last week, the 21st, we had reported 15,000 cases of infection in the vaccinated individuals. That's a 0.35% positivity rate. Darlene just told you right now we're seeing 5%. We're seeing almost 20 times that rate in our unvaccinated as in our vaccinated. So among those 15,000 people who had a breakthrough infection, and we expect breakthrough infections. Remember, influenza is provided to us year over year over year, and we've been doing it for many decades. But the best the vaccination efficacy rates have ever been to prevent infection might be 60%, more like 50%. So 1 out of every 2 people who get a flu vaccine, may not get the full protective effect. Here, we're much, much better, more in the high 90s. So of those 15,000 who developed an infection, only 571 have been hospitalized. And unfortunately, of those 571, or of those 15,000, some of these folks were at home, 131 deaths have been recorded. That death rate is 0.0003%, markedly lower than what we saw in our early outbreaks, particularly when you consider that our early outbreaks involved skilled nursing facilities and long-term care facilities, where our death rates were as high as 25% when we didn't have vaccine back in those days to support those high at-risk residents who didn't have anywhere else to turn. Next slide. The CDC data suggests that Delta is more infectious and probably more severe. And that is true. It is definitely more transmissible. The Delta variant is felt to be as transmissible as chickenpox. And in the human viral experience and all the colds and flus and infections and viruses that we've been able to contract as humans, only 2 viruses are more transmissible. That means able to be passed from one person to the next. And that is chickenpox and measles. And measles, you could almost look at a patient and contract measles. That's how very transmissible it was. And for those of you who are my age and grew up in the day of measles and chickenpox and mumps, it would go rampant through schools and through communities because it was so very transmissible. Delta variant is as transmissible as chickenpox was. And to kind of put a fine point on it, for those of you whose parents believed in chickenpox parties to try and better adapt their summer vacation with when I, as a child, contracted chickenpox, that's what my parents did to us. They took us to get exposed to chickenpox so we wouldn't get exposed during an inconvenient time. Well, that was, in retrospect, you want to go back to your father and say, what were you thinking? But that's how we used to do it. And all it required is, you go over to a little kid's house who was sick, and spend a little bit of time and, just be in the room with them. And next thing you know, you were coming down with chickenpox. This is very transmissible. And as you can see, the original ancestral strain, as we call it, every one infected individual would likely infect 2 more people. Whereas with the Delta variant, one individual is likely to infect 5 more people. And that's what makes the herd immunity so difficult, is that when I have such a transmissible virus and I'm having casual contact with people, granted 8 or 9 out of 10 might not have, they might be fully vaccinated and be at risk, but it's likely that 1 out of 10 every day, 1 out of 10 every day, 1 out of 10, I'm very likely to transmit to that individual and continue to propagate, the community spread within those unvaccinated, while ever decreasing numbers, but still unvaccinated numbers. And then as the last point, I think people do get sick. This is a more difficult strain. And as we are watching in the news every day, the number of people who are on ventilators, where families report if only they had gotten vaccinated, the number of pediatric hospitals and pediatric intensive care units that are at capacity. These are our youngest, most at-risk individuals because they have no availability of vaccine today. So people are getting sick, young people especially. And on the next slide, if I didn't make the point, it doesn't take long to just go out and Google search pediatric infection. And this is what you see is, pediatric cases on the rise in Central Virginia. Houston, first pediatric COVID death in a youth with no underlying conditions. Increasing child COVID hospitalizations, filling pediatric ICUs. Our children are right now our greatest risk. And if you're going to do anything to help protect your child, you're going to keep them socially distanced. You're going to teach them how to wash their hands. They're going to wear a mask. But if you're not vaccinated as a parent, how else will it come into the home except through you, potentially? And so these are the things we need to do to protect, our loved ones, and particularly our kids. To make it more of a point here at BMC, look at the curve of age of the number of positive cases that we're seeing. The 20 to 29-year-old group, as Darlene pointed out, is the highest number of positive cases that we've seen. But look at the 0 to 4, the 5 to 9, and 10 to 14 age groups. That's almost 3,000 infections in that age group. And this is, again, an age group that doesn't have a vaccine available to them and probably won't for the next 6 to 8 months. And so, these are we want to protect our children. I certainly do. And I would think most of you do as well. And then breakthrough infections are rare. I just showed you that out of 4,400,000 Massachusetts residents, we had 15,000 infections. So they do occur, but vaccinated individuals have an 8-fold reduction in infection versus unvaccinated. And if you get an infection as a breakthrough, you have a 25-fold decrease in your likelihood to be hospitalized. That was the Provincetown experience. A lot of people tested positive, but almost nobody went to the hospital or went to the ICU. And from a death perspective, that 25-fold reduction in the incidence of death if you had been previously vaccinated versus unvaccinated. Next slide. So what about booster shots? As you know, the first third dose that's been available and promoted by the FDA has been for people with immunocompromised conditions. Maybe they're organ transplant, kidney transplant patients. Maybe they're on cancer chemotherapy drugs that are trying to wipe out the cancer, but also, unfortunately, wipe out the immune system at the same time. Maybe they are people with underlying autoimmune diseases like rheumatoid arthritis or lupus or psoriasis or Crohn's disease. And these people also get very immunosuppressive drug regimens that make them less able to fight infection. And so the question was, do they need a supplemental dose? it's not that it's really a booster, it's that they never got as fully vaccinated as they could have. And so the literature quickly evolved to show us that, particularly with transplant patients, that a third dose, a booster dose, if you will, in that high-risk population actually was able to elicit high levels of antibody response and better overall immune response. And so quickly, the FDA said, in these high-risk situations, that these patient populations will benefit or could benefit from a booster shot. So talk to your patients, inform them, you make a decision together, and then we would recommend that then you can give, if they had a Moderna shot, give Moderna. If they had a Pfizer shot, give Pfizer. Unfortunately, J&J was third in line, and they're still in the process of developing their expanded authorizations for either booster shots or booster shots on the whole for us normal population. That came about with a recent Biden administration news brief that by September 20th, they hope to have boosters available for all the rest of us who don't have immunocompromising conditions or transplants. We don't know what that means. We don't know the roadmap towards getting there. We don't know the groups that may be priorities, if there will be. But we do know that it's very likely that we're going to see Moderna and Pfizer as the first booster vaccines approved, and likely too, J&J just submitted its information to the FDA to say, we see a massive increase in antibody response with the second dose. And so we would like to petition the FDA to also give us approval for a booster dose. So we're going to see booster doses. It's clear. And I think many of us are just kind of biding our time, or we're waiting the 3 weeks to see, because the North Adams Commons experience showed us that there are folks who, after full vaccination, probably, the older of us, the folks with more comorbidities, but not necessarily truly immunocompromising conditions, that we don't have as durable an immune response as we would like. And so boosters would be beneficial and would help certainly the aged or people with diabetes, underlying heart disease, obesity, asthma, lung disease. And we'll see this quickly come to the forefront with approvals. Next slide. So our ongoing challenges and risks today, we always worry about the vaccine supply chain. Certainly, Darlene and I have been caught unaware when testing supplies that were there yesterday are gone tomorrow. And that happened to us just recently. Abbott decided that things were going so well way back when that they laid everybody off. And then the Delta variant came out, and they just didn't have the vaccine or the testing capabilities that we would have wanted. And so we worry about that with the vaccine supply chain. We want to make sure that while we're trying to get the rest of these low vaccination communities vaccinated, we're going to have an awful lot of people who are interested in a booster. And at the same time, as we're trying to primarily vaccinate some people, others are going to be clamoring for and are looking for a booster vaccine. So right now, there's no indication that we're in any difficulty, but Darlene and I always have to be aware that we can't give what we don't have. And so we work closely with the public health departments and with the state to make sure that we have the supply we need to help you make sure that you have what you need when you come and ask. And likewise with testing, we had that little blip, and then just recently Abbott turned the faucet back on and we have test kits again. Gone are the days of saying, I'll give you your test in the morning results, or I'll call you late this evening. People want to know before they walk out of the building what their test results are. And that's what Abbott did for us. And when it fell in shortage, that was our concern, is that, people were used to having mail out tests where we'd have to send it to an outside lab and it would be 2 or 3 days later before we get the results. And then, with technology improvements, now we do it in 15 minutes. So who's not going to want 15 minutes? Everyone wants 15 minutes. One of the big issues we're facing with today is, we have EMS transport and ambulance transport issues. So the same way that we have staffing issues with nursing and lab and radiology and all of the subgroups within a hospital where we're short-staffed, the community is short-staffed with ambulance and EMS drivers. And that makes all the more difficulty in getting a child with COVID to the appropriate level of care. If they need advanced care, they need to be at Bay State, but we need to transport them to Bay State to get them there. And likewise with any of our adults who might have more significant neurologic injury or advanced surgical needs that don't exist here, they have to get to a higher level of care. Without EMS, how are we going to do that? And then lastly, it's just the human toll of this pandemic is that our healthcare workers and our community workers, everyone has been working hard, and even folks within the community, having to try and make payroll with only 25% capacity in your business. It's COVID care is complicated, it's stressful, and for all of us, it's something that we have to learn to manage, to take deep breaths and breathers when we can, to know that, sometimes a day off is exactly what we need. But we can't ignore the human toll that this pandemic has placed on healthcare workers and all of us in the community for that matter. Next slide. So what we know is the best way to manage our community is for vaccination, to help move beyond the pandemic, to help protect those most at risk, to help protect those who may not have access to a vaccine. And so our push and our plea and our reason for really informing you and participating with you today is to say, encourage, enforce, encourage, support, encourage vaccination among those people that you have influence with, those people that you care about, those people that you think might benefit. All of us, we need to do what we can to help promote vaccination as the #1 way to manage the Delta variant. But reminders, masking, social distancing, and good hand hygiene are those things that we always have to do in the background. Next slide. We have testing center availability in Pittsfield proper, at Fairview Hospital, and in North Adams. You can see here the times and the addresses of where that you can get, for that matter, both testing and vaccine. Right now, we have the Pfizer and Moderna available on Tuesdays and Thursdays, Pfizer and J&J daily with Moderna on Fridays down in Fairview, and Pfizer daily with Moderna on Tuesdays and Thursdays in North Adams. And so these are all testing center and vaccine administration centers. There are, you see 2 links below that help give you some additional information on just COVID science as well as the vaccine and pregnancy. So use these resources, and certainly any one of us here at Berkshire are happy to help and support, kind of in the same way that we're doing this. We can do it more focused, and I'm happy to speak to anyone who might have a more specific question and wasn't answered today. Next slide. I guess that's it.
All right, thank you. Thank you very much for a tremendous amount of information there provided so succinctly and with such clarity on both Darlene and Dr. Lederer. Is there any other specific highlights or specific thoughts that you wanted to share before we turn to this? I think there's probably a couple of questions we could follow up on.
I'm happy to take questions.
So one question that popped up that I thought was interesting. Fred Ruppberg with the Berkshire Eagle asked that the newspapers are reporting that Berkshires are averaging about 30 new cases per day. And then he asked what percentage of those cases are symptomatic individuals?
Yeah, I don't see, we don't get the breakout Many people are going to the testing centers and using the stop the spread conduit to try and get in and get a quick test. And so we don't necessarily have medical records for all the tested individuals. If I look at the number of people admitted versus the number of people that are testing positive daily, I would tell you that probably the significant symptomatic rate is quite low. So, 7 days a week, 30 positives a day, 200, and we're getting about 1 to 2 admissions a day. And so, that's a very, very small number. And of those admissions, fortunately, most are in the general medical unit and not in the intensive care unit. So again, kind of just like the slide I showed you, a much lower proportion of patients, who are certainly the vaccinated ones who are coming in that are symptomatic, but even amongst the unvaccinated, it is still a concern, but it doesn't seem to have the same symptomatology that say the earlier outbreaks did.
Thank you for that, Dr. Lederer. A couple more follow-up questions also looks like came up on the Q&A around booster shots. There was a question asking, and I know you commented about and shared some information about booster shots, but there's a question specific to the Pfizer vaccine of whether folks should look to get the booster sooner than 8 months, and that the individual asking the question is hearing kind of both views.
Yeah, I mean, I think we try and follow our state and federal guidances as much as possible. And so, that's why we're all waiting to see what the guidelines are and the recommendations are from the FDA on how to handle the booster shot. I think it will be an evolving situation, but right now we will follow the guidance that Massachusetts and the federal government put out, and we will stick with the 8-month time frame, and use that as our target, our benchmark, if you will. And with further data and with further guidances that we expect, we'll make transitions as we understand where federal guidance is going.
An interesting question from one of our listeners, and I don't know if any of you in the BHS team want to speak to this. Obviously, in your world, you abide by the science, and that is the world that you're working in, and we certainly appreciate that. But the question is, how do you suggest handling people who don't listen to the science? Which I think all of us probably encounter from time to time in our personal lives and our professional lives. I don't know if you have any thoughts from the BHS perspective on how individuals might handle those moments.
So everybody's rushing to answer that. I see. Jonathan, I tell you, we do focus on the science, and I think if you look at the presentation today, it's been driven off things that we know to be true, and we try to talk with folks, whether they're employees or members of our community, with respect. And people are going to have views that may be very different than ours. We hope that the science will overrule or be considered at least by them. And hope that they'll just keep an open mind and see if the benefits of vaccination outweigh any other avenue they may pursue.
Thank you for that, David. And I just want to, we're up to about 10 to 1. It's about 10 to 2 rather, as we're coming up on the hour. I just want to remind people, kind of a last call. If you do have questions, please submit them now while we have our panel present. Another question I see here. Actually, there's a question from our former chair at One Berkshire, John Bissell, asking if the slides will be available for sharing. So I'll take the opportunity just to respond to that and say that this session was recorded along with the presentation, and we will actually share with the entire list of registrations that are part of this webinar. We'll send a follow-up email in the coming few hours or by tomorrow morning with that, and that can be shared within your organizations. Another question that came up. And maybe Dr. Lederer would have some thoughts on this. With the Delta variant spreading so rapidly, aside from wearing masks, are there other things that vaccinated individuals should be doing to avoid breakthrough cases?
It's the same as we've been saying since day one, which is social distancing, hand hygiene, and wearing your masks. Unfortunately, we did get that little stutter start in the middle of the summer where we relaxed some of the conditions that the governor had placed on us, and we became excited that we were able to get together again and go outside and maybe, go out to a restaurant and go shopping. And, that's what we then later learned with Delta. That's what put us at risk, is we lessened our diligence and our vigilance a little too much. We need to stay aware of crowded social conditions. We need to stay aware of hand hygiene and trying to remove points of contamination. We need to remain aware that masking still is the way that the government tells us in healthcare that as long as we mask and our patients mask, we're setting up low risk situations where a patient to come in not known positive. And so masking, hand hygiene, and social distancing. And I personally was going to go visit my daughter in Florida. It's been almost 2 years since I've seen her, but I'm not going to get on a plane. I'm not going to take a chance. There's no reason, especially with Florida as such a hot spot as it is. I don't need the aggravation of getting a COVID infection, breakthrough or otherwise.
The only thing I would add to that is that people should continue to take advantage of testing. So if you've been in a crowded place and you couldn't honor that 6-foot distancing, stop the spread still is in place until October 15th at least, and maybe the governor will extend it even further. But it's free testing, whether you're symptomatic or asymptomatic, that allows you to get tested. Do it 3 to 5 days after that exposure to see if we can find anything there. And again, if you have any symptoms at all, be cautious. Don't be that person that's spreading the virus to others, and get yourself tested and make sure that it's maybe the common cold or allergies or something else instead of the virus that's spreading in our community.
Dr. Lederer, you mentioned not getting on a plane if that risk wasn't necessary, which I think certainly resonates with a lot of us. There's a question actually asked for individuals that are vaccinated. Is it safe to travel? Would you recommend against it right now, unless it's absolutely necessary?
Yeah, all of us have to make our own decisions, and it all depends in our own close family and social circles. Were we to get a COVID infection, while I've said that the vaccinated folks do better, am I going to spread it to my child? Am I going to possibly transmit it to my grandparents or my parents who, maybe are more frail and won't respond as well to their prior vaccination? I mean, these are all decisions we have to make. If you don't have to travel, or if you can travel, by car and end up in a place where, you can socially distance, a mountain cabin, a beach house. If you can do it that way, then I think that, you're not much different than living here in Pittsfield. But if you're on a plane, if you're on, public transportation, you just have to be aware that you don't know who you're sitting next to.
Thank you for that as well. And I think that's one that's been on a lot of our minds. Certainly, as a lot of people got back into regular travel patterns in the last 6 months, and now obviously we have additional things to consider and additional data to pay attention to. So I think it's important for people to think responsibly about those decisions. There was a question, and thank you all for your patience in answering some of these questions. I think this is really helpful to our listeners and gets more good information out there. There was a question posed about another question about booster distribution, asking what that might look like. Is that something that will have to be individually managed through our doctors, or do you envision something similar to the original vaccine rollout with clinics and walk-in facilities?
Yeah, Darlene's the expert on all things community-wide vaccination, so I'll let her answer.
Okay, so yesterday the ACIP, which is the recommendation body for CDC on vaccination and immunization, I had a meeting, and the FDA will be meeting next week on these booster shots, and that will give us more information on which populations they're going to focus on for boosters. Once we understand that number, we'll put a plan together. We've already been in touch with Laura Kittredge and others from the Berkshire Regional Planning Board to see if there's any interest in running large clinics, assuming there's an adequate supply of the vaccine to be able to get those boosters in people's arms. And so we'll figure it out. And like we did in the past, we'll work as a community to make sure everybody has the access that they need to make this as efficient as possible.
I had a question from the employer perspective, because again, it's one that we receive with our organization on a regular basis from our membership. Obviously as employers, we're doing the best we can to encourage our members of our teams to become more informed, to look at the data. We're encouraging them to be vaccinated if they haven't already been vaccinated, providing resources for that. Are there any other things employers, from your small downtown shops to your larger employers that have, dozens, if not hundreds of people, is there anything we could be doing collectively or individually within our organizations to help the greater cause, beyond just continuing to encourage vaccination?
Jonathan, part of what we hope today might foster is an ability for us to be partners with you and any other people on the call. If it's useful for them to hear from someone other than their employer directly, we'd be happy to work to develop any kind of an efficient mechanism to do that. So we know that in our community throughout COVID and frankly for many other matters, look at who's participating on the call today. We all have a track record of working well together around all issues that are important to our community. I would argue that this one is as important as any we faced together over the past 20 years. We're willing to use our knowledge, our time, our energy to engage with as many of the employer groups as can be organized over the next month or two. We think it's that important. I think one of the messages that you heard loud and clear from Dr. Lederer in particular is the best thing we can do to push back this pandemic and to provide some relief to this community is to increase vaccination rates. It's clear that is our path out. So I would offer to you and anyone on the call, if there's any idea you have on how we may help you, talk to your employees or friends, colleagues, we're happy to do that. And that's part of what we hope to accomplish today was to ensure that people understood it's a very sincere offer that we think is important for all of us.
I think that is very sincere and extremely helpful, David. And I would certainly encourage all of the participants in this call in your organizations, if there's an opportunity for that to be a resource for you and be helpful, please take advantage of it. Collaboration and communication right now is so important. And employers are, one of those places where you can connect with dozens, if not hundreds of people, through your channels and your communications. It's a great way to get better information out into the hands of residents and workers.
Jonathan, we've had some success with some employers who earlier have asked for some assistance, and we think we're reasonably well organized to do that efficiently and be helpful.
Excellent. So maybe two more quick questions. There was a question about, and this is directed towards Dr. Lederer again, there's a question about the Delta variant, which spiked up and then spiked down in India and the United Kingdom. And the question is whether you have any thought as to whether we'll see a similar downward spike sooner than later in the US.
So that's hard to say because it depends on our behavior. What people understood within India and the UK in specific was that the public health measures were much more aggressive and supportive in those countries than we are currently. When COVID first broke out, we were very, very strict and very, very formal in how we handled outbreaks and testing and quarantine. And I think we've gotten a little bit lax over time. And I think that's, just part of the ennui and the weariness of being always in a pandemic. But I think, it's not that they're that much better vaccinated than we are. It's just that I think they adhered to the public health guidances that they had put forth for their communities, and they were able to see a downturn. And I think if we individually within Berkshire County, I'm seeing many, many more people when I go to Walmart or Target who are masking. And that wasn't the way it was in June. Almost none of us were masking. I mean, I'm as guilty. I was happy. Everyone said we're supposed to be okay. And so we thought we were, but we weren't.
I think that's great insight. Obviously continuing to become vaccinated if you haven't done that yet, and pay closer attention to your behaviors on a daily basis. All of us can play a role in hopefully seeing a downturn sooner than later. I'll throw out one. We're at 2:00, so just one last quick question, and I think this is an important one because I know this can potentially alleviate a lot of pressure on the healthcare community as you do deal with the Delta variant and other issues related to COVID. But how early should people be getting their flu vaccines this year?
They should get it during the normal flu season. So, when we start having flu vaccines available, and you can get them from your physician's office or from, the community providers, do it. And it is interesting in that last year, while we did have flu vaccination and we were aggressive on that, we also had very significant masking and social distancing and capacity reduction, and we saw no flu. The US saw no flu. And we also saw no pediatric ear infections. And we saw half the number of admissions for pneumonia. And we saw half the number of admissions for congestive heart failure. So managing viral infections on the whole, whether it's flu or COVID, is definitely to the betterment of yourself individually and the community at large. And so follow the normal, flu availability clinics and go and get your flu shot.
So there it is for our listeners. One additional thing that you all can do to help the greater good in our region, and that's go and get your flu shot when they're available. So as we wrap up, any of you, Darlene, Dr. Lederer, David, any final thoughts you want to share before we conclude?
I guess, John, certainly want to thank everybody for participating today. We're grateful for the assistance they provided to us throughout this pandemic. People in this community have been responsive and helpful every time they've had a call. And we hope today it will be no different. We do want to again say that it's like we started. We need to kind of renew our attention and diligence around this issue for a while. It would be great if we were to the other side of this, but we're just not. All the reasons for vaccination that Dr. Lederer and Darlene talked about are true. They're based on science. And whatever help we can get to encourage people in the county to help us improve our vaccination rate, we will be grateful for. And we would like to connect with anyone who's participating on this call to help them if there's a way we can be helpful.
Thank you very much for that. And on that note, I just want to thank the three of you, and also Jennifer Vrabel, who was the person behind the curtain for Berkshire Health Systems with the presentation this morning from your team. But I want to thank the whole BHS team. I mean it deeply when I say I think we very much feel like we've been well served by Berkshire Health Systems these past 18 months. Your compassion, your transparency, your accessibility have just demonstrated great leadership in a moment where we've certainly needed it. So thank you all for what you do for our community and will continue to do for our community.
Thank you, John. And just remind everybody that Darlene, Dr. Lederer, and I get to represent 4,000 people who do this every day. So.
And we thank each and every one of them in a moment when they've truly been tested, and the Berkshires served all of us very well.
Thank you very much for saying that. Appreciate it.
I also just want to quickly thank my team at One Berkshire for helping put together this webinar and promoting it. I want to thank all of our listeners who took some time this afternoon to chime in and learn a little bit more about what's happening here in the Berkshires with the pandemic. And with that, this will be available for those of you that missed it or missed a portion of it. We'll be sharing it through various One Berkshire channels. I'm sure Berkshire Health Systems will be doing the same. It'll probably also be replayed through Northern Berkshire or Pittsfield Community Television and some of the other subsidiary local television networks in the Berkshires. So on that note, once again, thank you all. Have a great afternoon. Be safe and be well.
Thank you.
Thank you.
Thank you.